So hello everyone, my name is Miloš Peric, I'm from Serbia, and I'm program coordinator of HIV/AIDS preventive and testing services in organization Association Rainbow. I would like to share with you experience of my organization during COVID-19 outbreak. So at the very beginning, I would like to introduce my organization and also to share with you epidemiological situation regarding HIV/AIDS in Serbia. So here is our team. So Association Rainbow was established in June 2004 and operates on the territory of Serbia. It was founded by LGBTIQ persons with the aim to improve the lives of LGBTIQ people, primarily in small and rural communities in Serbia, with a special focus on multiply marginalized persons, such as LGBTIQ persons who live with HIV/AIDS, LGBTIQ Roma people, LGBTIQ people with disabilities, etc. So our mission is to improve the quality of lives of the LGBTIQ people and their families through developing and providing health and social services which are not available to LGBTIQ people or do not exist in the legal system, and through education of professionals from various fields about an adequate and sensibilized approach in working with LGBTIQ people. In the context of prevention of HIV/AIDS and other sexually transmitted infection, currently our main focus is MSM population. So on the territory of Serbia, we have developed an outreach service of counseling and testing for HIV and STIs in mobile medical unit. So we are one of the few NGOs in Serbia which has the possibility of providing health services outside the medical institutions. So our services include counseling and testing, linkage to care, peer support, psychosocial support, and medical consultations. Here are some photos during our actions before COVID-19 epidemic. So when it comes to epidemiological situation of HIV in Serbia, although we are the country with the low prevalence of HIV infection in general population, it is important to emphasize two additional facts. Firstly, the percentage of people who got tested is really low. And secondly, the last biobehavioral research study, as well as the data we get in the field daily, showed a constant presence of concentrated epidemics of HIV among MSM population, which is about 5%. So, according to the data of the Institute of Public Health of Serbia, since the beginning of the HIV epidemics in Serbia in 1985 up to the November 2019, there were 4,027 persons infected with HIV, of which there are 2,022 with AIDS diagnosis. 1,150 persons have died due to the AIDS, and 121 HIV positive persons died due to the illnesses or conditions non-related to HIV or AIDS. As it was in the previous period, also in 2019, the main way of HIV transmission was a sexual way, 89%, especially through anal sexual intercourse among men. For the period from the January until 20 November of 2019, there were 175 newly diagnosed persons infected with HIV, which is 35% more than last year in the same period. So in 2018, it was 130 persons. In the same period, 55 persons were diagnosed with AIDS, and 16 persons died of AIDS-related illness. There were 8 times more men registered than women, 156 men and 19 women. So the majority of newly diagnosed HIV-positive persons are between 20 and 49 years old. In relation to the mode of transmission, in 156 persons, HIV was transmitted through sexual intercourse without a condom. So it's 97.5% of all cases with a known mode of transmission, of which 134 were men who reported risky sexual intercourse with other men, so NSM population. It's 84% of all persons with a known mode of transmission. So in the same period, there were only 2 cases of HIV infection where it has been reported that the mode of transmission was through injected drugs, as well as 2 cases of HIV infection among children, where the mode of transmission was from a mother to a child, being that mothers didn't know that they were infected before they gave birth. And for 15 persons, the mode of HIV transmission was not reported. Currently, there are 2,756 persons diagnosed with HIV, and it is estimated that there is at least 400 persons in Serbia who still doesn't know that they are HIV positive. When it comes to COVID-19 situation in Serbia and adaptation of our HIV services, it is important to say that at the very beginning of the epidemic in Serbia, the state of emergency has been introduced with the aim to stop the fast spread of the virus. So this included the introduction of the measures of complete lockdown for the persons older than 65, and partial lockdown for the rest of the population between 5 p.m. and 5 a.m. This also pertains to the working hours of the shops, while schools, universities, bars, clubs, and parks were completely closed. All the medical institutions, from the primary health care to all others, have been primarily focused on COVID-19 diagnostics and treatment. So infection clinics that used to be involved in HIV treatment have been transformed into COVID-19 clinics. So that certain interventions in relation to the HIV have been postponed for the period after the COVID-19 crisis, while only the emergency cases of HIV were treated. At the moment, antiretroviral treatment can be collected at designated pharmacies, or that pharmacies can organize home delivery of treatment. Being that the state of emergency measures were introduced, it was obligatory to follow the lockdown orders, as well as to keep physical distance between citizens. Therefore, this has severely impacted our ability to provide our services to our target population in the way it was firstly designed. So we had to adapt the services so that they stay in accordance with both the needs of our clients and with the state of emergency regulations that were in power. So the only services we were able to provide to our target groups during the very outbreak of the COVID-19 epidemic in Serbia were communication and information distributions to our clients via phone, internet, and social networks, dating apps, and online counseling. We have also, during that period, translated to the local language and distributed the most important messages given by relevant international organizations such as the UNAIDS and International AIDS Society regarding HIV/AIDS and COVID-19. So at the very beginning of the epidemic, we have also providing social support services, including delivering basic food, hygiene products, and humanitarian assistance for most vulnerable populations in our community. So here's some photos during our action after COVID-19 outbreak. So many civil society organizations stayed without access to the funding due to the epidemics, because the funds had to be diverted to the COVID-19 crisis resolution. So in regards to the MSM population, Association Rainbow was one of the rare organizations capable of timely response to the circumstances and the needs of the target population. And following the UNAIDS guidelines on HIV counseling and testing during COVID-19 epidemic, organized the counseling and testing activities in a safe space during mid-April. So based on the UNAIDS guidelines on the HIV counseling and testing during the COVID-19 epidemic, we made the decision to continue with our services in this field. Being that venues and spots where MSM population used to gather were now closed due to the state of emergency measures, we had to arrange a special suited space safe for the both clients and our staff during the COVID epidemic, which included our mobile medical unit and spacious drop-in center, while all the appointments had to be booked in advance, and only one client per appointment was able to stay in the facility at a time. So work method in these circumstances is provision of standard counseling and testing services with special precaution measures such as the usage of protective masks, gloves, and protective visors, provided not only to our staff but to each client too, as well as application of the means for disinfection before and after each intervention. The information given by the counselors also include basic information on the measure of protection from COVID-19 and its potential joint impact with HIV/AIDS. Here is also some photos during actions. Since our organization has established long-term cooperation with the public healthcare institutions relevant for HIV, we were able to refer each new HIV diagnosed client to the respective institution for confirmatory testing and linkage to care, with the option to accompany each individual through the entire process if needed. Here is our mobile medical unit. What we have learned and concluded during the above-mentioned challenges is that the risk from HIV was constantly present among most vulnerable population, as well as their need for the information and our services, primarily counseling and testing, as well as informative and protective materials such as lubricants and condoms. Moreover, the need was even greater due to the fact that most of the services of this kind were completely unavailable to our target population during the first 2 weeks of the epidemic outbreak. So this situation clearly showed that it is necessary to introduce additional options in the future, such as self-testing, for example. Even though the lockdown has been removed and many social activities are being resumed, the physical distance measures are still requested. And since it's not sure when the COVID-19 threat will be gone, we will continue using the already described work methods in the future. Also, the scope of our activities will stay the same because the clubs and bars are still closed. And therefore, we need to reach out to our clients as we are currently doing. And we definitely intend to work on the new services in the future. And the most important one will be introduction of self-testing for our clients. So this was a short review of the way we in Asocijacija DUGA, or Association, were able continue with our services during COVID-19 crisis. So thank you for your attention, and if you have some additional questions regarding our work, my contacts are below, so feel free to contact me. Thank you very much again.